Good morning, everyone. As Kato mentioned, my name's Jose Etchart. I'm the Bighorn Sheep program leader. And I guess I get to work not with the best or the coolest, but the greatest species in the state of Texas, I feel like. But today I just kind of want to give y'all a little update on where we stand on the program in itself, the disease that we're dealing with, and path kind of moving forward. I'd like to start with this slide. Why do desert bighorns matter? And 2 years ago, we actually had an educational series that was ongoing in the Franklin Mountains. And we had a bunch of biologists go out there, researchers, conservationists, talk to the general public in El Paso. And we're just telling them about why we wanted to move sheep to the Franklin Mountains. After pretty much a day out there, my predecessor, Froilan Hernandez, was out there and he was finishing up his presentation. And whenever he was done, this young lady in the audience raised her hand and said, "But why do we care again?" And you could just see the face of disappointment on Froy. And he literally just nodded his head, dropped the mic, and walked off the stage. So these are my points of what I believe desert bighorns matter. And, first of all, they're a native icon of the Trans-Pecos in the southwestern United States. They're adapted to the rugged desert mountains. They hold a very high ecological, cultural, and economic value to the areas they reside, and they're real significant when it comes to hunting and wildlife viewing opportunities. One thing that I want to point out, it's that last point, and that's from all the years that I've been working, with bighorn sheep. I do truly believe that bighorn sheep are kind of an indicator species of just how healthy our mountain ecosystems are. And I feel because they hold that special niche in those high elevation mountains that I do believe if the sheep are doing good, the rest of the mountain ecosystem's doing well. So why are we here? And the big thing is there's a big restoration success that's been going on in Texas is at risk right now because of the Mycoplasma ovis pneumoniae that Dr. Wyckoff talked about earlier. Since 1957, the Bighorn Sheep Restoration Program came about from Texas Parks and Wildlife, Texas Bighorn Society, and then other Western entities. And since to date, we've had a total of 54 translocation events throughout the Trans-Pecos. Since 2010, we translocated a total of 558 desert bighorn to 12 of their 16 historical mountain ranges. And the highest population estimate that we ever had was in 2014, where we were estimating about 1,500 desert bighorn, which were the numbers in the late 1800s, historical numbers, which has been really successful. But as I mentioned, the hard-won success is threatened by disease, and that's really what I'm going to talk about today. I won't touch too much about this since Dr. Wyckoff already talked about it, but the big thing she already talked about the disease, but what I wanted to point out, so Mycoplasma ovis pneumoniae came about in the 1970s. It was first documented in North America in domestic sheep and goats. Later in the 1980s, that's when it really became established in wild sheep populations, and it became a problem in other Western states. And Dr. Wyckoff already talked about how the disease works, how it operates. The biggest thing that we're seeing is once the MOVI hits a population, we'll see an adult die-off occur, and then several years, 2-3 years after that, we'll be seeing some lamb die-offs as well. So in order for us to keep the populations ongoing, we need that lamb recruitment, and this is something that's affecting us right now. This is the current statewide survey since 2002 to 2025. And as you can see in 2014, that's where we really plateaued at about 1,300 desert bighorn. This was just when we do our surveys, we do them out of a helicopter. We fly contours. We start at the bottom of the mountain and kind of push everything to the top, and then we do our counts. All of our survey numbers are based out of observed individuals. We really don't have a true way of estimating population right now, but that's what we have. And in 2019, it's when we started to see that decline trend start happening. And I do want to point out in 2020, that was a year of an incomplete survey. That's when we had the fatal helicopter crash where we lost some of our biologists, and that was an incomplete survey year. But we were already going in that decline. And in 2023, it hit one of our biggest herds up in the Sierra Diablo, and we really tanked to about 568 bighorn. And right now, last year's surveys show a number of 724. There is a little slight increase, which I do believe part of it is also because of the translocation that we did in the Franklin Mountains. So we were able to move some sheep from elephant, put them in the Franklins, and we got really good lamb recruitment there as well as in elephant, and that's where we have that little increase. This is our adult and lambs population trend, and once again, going down to 2019, you can see how that decline happened. And then when it comes to our lambing crops, the trend pretty much stayed below the population trend overall. And that's where we're at right now. We're hoping for that this year with the rain conditions that we have. We're probably going to jump that population trend. So the vector, and I guess the biggest thing that I want to point out is, so a movie originated from domestic sheep and goats, right? And here in Texas, we don't have that type of industry here in the Trans-Pecos. But what we do have is Aoudad. And I'm not saying the Aoudad pretty much gave it to the Bighorn. It could have been vice versa. But I do want to say the Aoudad right now are the vector of the disease. And it's creating a big problem just because of the abundance and how well they're doing on our desert landscapes. The biggest thing is they reproduce quickly, often having 2 sets of lambing peaks throughout the year compared to a Bighorn just having one. From our surveys that we've conducted every year, which within sheep habitat, right now we have a population estimate of at least 60,000 plus, which if you really start looking at Justin's numbers, we're way past that. So he'll present on that a little earlier. Another thing, it's just resource competition. It's not just for the Bighorn, but also for our mule deer and even some of our livestock industry. It's causing problems to some guys of just overgrazing, and being able to put cattle on some of these landscapes. And the big one being they do carry a Moby, and it has very little effect on their survival. So when we first found it in 2019, it kind of paused all our restoration efforts. We found it in the Bighorn Mountains. The population from 100 sheep went down to about 20 in less than a year. And then we later found it in Black Gap WMA, and it kind of had the same type of decline. But since then, we started our disease surveillance efforts. And in 2023, we decided to really focus on all these different mountain ranges that pretty much border any sheep ranges, and go in there, take some Aoudad down and test for the disease. As of now, Dr. Wyckoff mentioned the difference between ELISA versus PCR. So ELISA is pretty much that individual has been exposed and shows antibodies of the disease, compared to PCR positives is that individual at that time of the sample was currently active. So from all the sampling that we've done over 500 Aoudad samples. We tested over 17 mountain ranges in the Trans-Pecos, and we've had positive ELISA results in all of those mountains. So Aoudad have been exposed and at some point have been carrying the disease. With that, there was a big urgency to start a new herd, especially because we have those threats of Aoudad coming into Elephant Mountain, and that's how the Franklin Mountains projects kind of came about. A mountain range that potentially we would have never thought about being in such an urban scenario, but that urban scenario kind of served as a high fence, kind of around that area that was protecting, any Aoudad movements coming in. As of now, this is the scope of infection in Texas Bighorn. You see Franklin Mountains, that's one of our clean herds. Elephant Mountain, one of our clean herds, but we do have it up on the northern zone, and we've confirmed in the Sierra Diablos and the Beach Mountains, in the Bighorn Mountains, and we don't have true disease samples right now taken from the Eagles or the Baylors, but we do have landowner reports of them seeing sheep coughing out there. So we believe that area is also infected. Coming down to Brewster County, you can see Black Gap WMA. That's where we have that population has been stable. It looks like that strain wasn't as virulent as the one we had in the Bighorn Mountains, and that population is stable. We continue to monitor that population real closely with GPS collars, and we're still testing. There's still the ELISA results positive, where there's still exposure, but we're not having any PCR positives. This is the scope of infection in Texas Aoudad herds. Like I said, there's 17 mountain ranges that we've collected samples of. Every time we do one of these efforts, we try to go and collect at least 30 30 aoudad from those particular areas. And in all those mountain ranges, we tested positive with ELISA results. So with all this disease surveillance, lessons learned. The biggest one the program had stand in the past 10 years was we need to put sheep put sheep back on the mountains, build connectivity, and get those populations to grow. Right now, with the disease issue that we're dealing and the aoudad populations throughout the whole Trans-Pecos, it's more about separation. And that's something that other Western states have been dealing with when it comes to this disease in terms of building separation on domestic sheep and goats. The challenge is, for us, we're actually dealing with a species that it's aoudad, it's wildlife. We can't really regulate it as they can the domestic sheep and goat problem. So the biggest thing right now, it's a learning process. It's an adaptive management strategy now, where as the data comes in, we're pretty much adapting to coming up with new decisions and moving forward. This is our current management toolbox. We're closely monitoring public and private lands where we have bighorn sheep. We have 27% of a Texas sheep right now collared, so looking at movements and survivals. We also started an aoudad control response program where we're pretty much helping landowners. They reach out to us and we can go control aoudad populations in areas that are in close proximity to bighorn sheep ranges, and we provide financial help to those efforts. We're doing a diagnostics testing where it's not just the disease surveillance, but also the strain typing. This is going to be really important moving forward so that we can figure out what kind of strains out there are the ones that we're going to be able to work with and which ones are not. Translocations, this is not a thing of the past. We're still very open to translocations. We are changing a little bit our mindset. Before we were thinking about, let's focus on these sheep, high quality habitat areas. And now we may be a little bit more receptive towards looking at some moderate quality areas for sheep. The idea is in those moderate areas, there's probably a more controllable aoudad population that there is on those high quality areas. And then a quarantine program. So we're fixing to purchase 50 acres just south of Alpine where we're going to high fence and build this quarantine facility. We're having problems with aoudad coming into Elephant Mountain and having bighorn also leave Elephant Mountain and coming back. So with a movie being out on the landscape, we have problems with those sheep leaving, getting exposed, and then bringing the disease back. Right now, we don't have any management for that, so we pretty much have to go and euthanize the animal. And by building this quarantine facility, we'll be able to capture the individual, put him in the quarantine facility, test him, clear him in about 20 days or so. If he's negative, put him back on the mountain. If he's positive, then we'll probably euthanize him. And this will probably spark the idea of starting to looking at movie research treatments in the future. But that's what we're kind of working towards. And the big one is just landowner partnerships. We're trying to establish cooperative agreements, which we have a lot within our WMAs. Everything that borders our WMAs, we have some co-op agreements. But now we're trying to update those agreements to where we have more bighorn sheep management disease plans in them. So that's something I'm going to be working on. This is the current research from carrying capacity. We're looking at Elephant Mountain, Franklin Mountains, what that's looking like. We have a metapopulation study going where we're looking at clean versus infected individuals. We have the MAM project that Justin's kind of been working on, looking at a movie and water guzzlers, looking at the movement and understanding, the spread of bighorn and aoudad in different areas and potentially being able to do some disease modeling. And just overall looking at hunting impacts on aoudad populations in the Waco Mountains and just seeing how that would potentially impact some of that decline. If we could use hunters for that, or should we be continuing to do our aerial gunning? Our restoration highlights. So as of May, we flew lamb assessment surveys. We estimated a total of 100 to 110 bighorn with a 62% lamb crop in the Franklins. So we're really excited about these results. It's working. The future of the program is to build and protect our clean herds, Elephant Mountain, Franklin Mountains, work on aoudad control, and do our risk assessment as we move forward to translocations. Continue our disease surveillance and research, and also just a big call for landowner support. This is not over. We still have sheep, and we just need y'all right now to whoever wants sheep, we need to start having these conversations of what we can do to potentially put sheep on those mountains. So my final message, there's still light at the end of the canyon, and restoring desert bighorn sheep required 50 plus years of dedication. Protecting them will require the same commitment. Guided by science, collaboration, and adaptive management, we can't do it alone. We need y'all. Thank you.
Thanks, Dr. Etchart. Is there a vaccine that can be introduced into the bighorn population against MOB?
No, ma'am. So that's something that throughout the past 20 years, different states have been working on trying to see if potentially they could come up with a vaccine like that. The thing is, it just changes so much, the different strains, that they haven't been able to really key in on one specific one. There's a lot of research that goes in it, but just the way the disease it kind of evolves, it's real tricky. And Amobi is also a strain that has been in the swine industry for years, and they can't even figure it out as well. So it's a really challenging disease.